control. And I'm raising tobacco control because of the effects, the added effects when you add betel nut or why. It's been found that betel nut use is increasing in Papua New Guinea. We did a survey of the youth up to the age 15, and we realized that both sexes, the boys and the girls, the use of buai is increasing. Then the other thing that we also found, which is disturbing, is that not only is the buai use increasing, but what is also increasing is the chewing of tobacco. And the problem is when you put buai and tobacco together, it's a recipe for disaster. And I think Chief Dental Surgeon has already mentioned, some of the implications, some of the clinical implications, and I wouldn't, go through that. But I was looking at the agenda, and I realized that I needed to start speaking at 1:15, and I needed to finish at 1:15. So what's going to happen is I was given 1 minute, and I'll try to do it probably in 3 minutes. The other thing that is also happening is that because we have buai and chewing of tobacco all together, what we are beginning to see is that, and I think Chief Surgeon mentioned it, it induces a stage in your mouth that we call the precancerous phase. What it means is that things begin to happen in the skin of your mouth once you use buai and tobacco, that gradually the skin of the mouth begins to change, and that change is what Chief Surgeon mentioned, that we have a latency period that within about 25 years you can develop cancer, and we need to take it seriously. And I think the other thing that is also happening is not only do we have buai and then chewing of tobacco, but then we also add alcohol. So now you have buai, you have tobacco, and then you add alcohol. It even speeds it. It makes it faster. If you are going to have the cancer in 25 years, it brings it even more forward. And I think we